Common mental health disorders. Anxiety. A feeling of unease, such as worry or fear, that can be mild or severe. It's completely normal to experience feelings of worry or fear. However, when someone experiences these more consistently, they can be hard to control and can affect them from doing simple and everyday activities. People who have an anxiety disorder may also experience anxiety. Panic attacks. Attacks are episodes of intense panic or fear which usually occur without warning and may or may not have a trigger. Types of anxiety disorders. Generalized anxiety disorder, GAD, social anxiety disorder, panic disorder, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, OCD, health anxiety, body dysmorphic disorder, BDD. OCD. Obsessive-compulsive disorder is where people experience obsessive thoughts and compulsive behaviors. What is an obsessive thought? It's an unwanted and unpleasant thought, image or urge that repeatedly enters a person's mind, causing feelings of anxiety. What is a compulsive behavior? It's a repetitive behavior or mental act that a person needs to carry out to relieve the unpleasant feelings brought on by the obsessive thought. For example, someone with an obsessive fear of their house being burgled may feel they need to check all the windows and doors are locked several times before they can leave the house. PTSD. Post-traumatic stress disorder is an anxiety disorder caused by very stressful, frightening, or distressing events. Someone with PTSD often relives the traumatic event through nightmares and flashbacks and may experience feelings of isolation, irritability and guilt. This can also lead to problems sleeping such as insomnia and issues with their concentration. Symptoms are often severe and persistent and have a significant impact on their day-to-day life. Depression. Severe feelings of unhappiness, inadequacy and guilt. Everyone goes through periods of feeling down. However, someone suffering from depression can experience low mood, loss of interest, feelings of guilt or low self-worth, disrupted sleep and appetite, low energy and thoughts of death or suicide for weeks or months at a time. Bipolar, also known as manic depression, specifically affects someone's mood, causing them to experience extremely high moods, manic episodes, and extremely low moods, depressive episodes. The contrast between these moods can make the depression seem deeper and can be harder to deal with. The manic episodes aren't just a consistent happy feeling, they can actually make people irritable and agitated, easily distracted, confident, adventurous, untouchable, like they can't be harmed and see things others can't. These feelings affect the person's behavior and they may become more active, talk a lot or tasked, very friendly, say or do things inappropriate or out of character, sleep very little or not at all, be rude or aggressive, and even take serious risks with their safety. The depressive episodes aren't just a consistent sad feeling either, they can actually make people upset, tired or sluggish, not interested in or find enjoyment in things they used to, low self-esteem, lacking in confidence, guilty, worthless or helpless, agitated or tense, and have thoughts of death or suicide. These feelings affect the person's behavior and they may become withdrawn or availed, people not do things they usually enjoy, have trouble sleeping or sleep an excessive amount, eat too little or too much, self-harm or attempt suicide. Eating disorders. An unhealthy relationship with food which takes over someone's life. Different types of eating disorders. Anorexia nervosa. This is where someone tries keep their weight as low as possible by not eating enough food and exercising too much. Bulimia is where someone can lose control and eat a lot of food in a short period of time, binge eating, and then are deliberately sick, use laxatives, restrict further eating, or do too much exercise to try to stop them from gaining weight. Binge eating disorder, BED, is where someone regularly loses control and eats large portions of food all at once until they feel uncomfortably full. Other specified feeding or eating disorder is when a person's symptoms don't match those of the above disorders but they still struggle with their relationship with food. This is actually the most common eating disorder and is just as serious as the others. Personality disorders. Affects the way someone thinks, feels, behaves or relates to others, their personality. There are many different types of personality disorders but they are usually grouped into three categories: suspicious, emotional and impulsive, and anxious. Suspicious disorders. Paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder and antisocial personality disorder, ASPD. Emotional and impulsive disorders. Borderline personality disorder, BPD, histrionic personality disorder and narcissistic personality disorder. Anxious disorders. Avoidant personality disorder and obsessive-compulsive personality disorder, OCPD. Psychotic disorders cause abnormal thinking and perceptions and people can lose touch with reality. People with these types of disorders have difficulty thinking clearly, making good judgments, responding emotionally, communicating effectively, understanding reality and behaving appropriately. They can also experience hallucinations and delusions which can last several months. What are hallucinations? Hearing or seeing things that are not real. What are delusions? Believing things that are not true. Types of disorders: schizophrenia, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, delusional disorder, psychotic disorder due to a medical substance-induced psychotic disorder, condition and paraphrenia.